Well, hello, everyone, and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists, where each month MCW brings you the science behind the health topics that you're hearing about in the news. This series is brought to you by the Advancing a Healthier Wisconsin Endowment, the state's largest health philanthropy that works to improve health and advance health equity in Wisconsin. I'm Dr. Jesse Ehrenfeld, Director of the Advancing a Healthier Wisconsin Endowment at the Medical College of Wisconsin, and I'll be your host today. I am so thrilled to be here to talk with Dr. Christina Runge, who is a professor in the Ear, Nose, and Throat Department at the Medical College of Wisconsin. She's also the director of the Koss Cochlear Implant Program, and she's going to talk about the science behind hearing loss. Now, Dr. Runge joined the Ear, Nose, and Throat Department at MCW back in 2002 and has directed the Koss Cochlear Implant Program, which is a collaboration between MCW, Froedtert Hospital, and Children's Wisconsin since 2005. She received her doctorate from the University of Iowa, where she focused on the auditory neurophysiologics responses and has received extensive training in hearing disorders and cochlear implants, both in adults and children. Her research interests include hearing devices such as cochlear implants, hearing aids, and the genetics of hearing loss, as well as drug therapies for hearing restoration. Chris, welcome to Coffee Conversations.
Thanks, Jess. I'm so happy to be here. Thanks for having me.
Oh, this is going to be great. So today we're going to chat about the science behind hearing loss and what are the most common types of hearing loss and what you can do if you or someone you love is experiencing symptoms of hearing loss. So for everybody watching us today, go ahead and drop any questions that you have on the topic into the comments. We will get to as many of those questions as we can. So let's go ahead and dive right in. First of all, Chris, hearing loss is a very broad topic. What's the definition of hearing loss?
That is such a great question. And it is broad, and it also is, hearing loss is a very common disability and worldwide. And so I think we might even have a slide for people to see that with some data on there. It's 466 million people have some level of disabling hearing loss worldwide currently, and that's estimated to increase to over 900 million by 2025. So even in the next few years. So, and one of the big issues with that is that people have hearing loss, but fewer than 20% of adults with some hearing loss actually use amplification or are able to address that or addressing that right now. So an untreated hearing loss can lead to not only do you have difficulty communicating and the hearing loss itself, but it also can be very isolating. It can lead to depression, and it's actually been linked also with some other health issues such as dementia and even risk of falling in older adults. So it's something we really want to address. It's a very serious health issue. And so really excited to be able to get the word out today too to our community and about reaching out and getting help if you notice any kind of hearing loss. So I think you did ask me, if I may continue, like, what is my definition of hearing loss? And so, like you said, it's a very broad topic, and I'll break it into a couple. Is one, you can be born with hearing loss, or you can develop it over time, maybe in childhood or most like toward adulthood. So I'll focus mostly on the type that develops over time, that might sort of creep up on people and you're not really noticing it at first. But my definition of hearing loss is if you notice that you're having difficulty hearing in some daily listening situations that maybe you hadn't before. So, a little more trouble in background noise, or you can hear people, but you can't quite understand them. That might be indications that you have some hearing loss compared to what if you had normal hearing before.
Thanks for that. So profound implications for people who have hearing loss on them, on their families, on safety, economics, lots of things wrapped up there. But what's the most common type of hearing loss, Chris?
For the population we're talking about, if it's sort of gradual onset as you get older, the most common type of hearing loss we would see in adults we refer to as sensory neural hearing loss. And what that refers to is there are little cells in the inner ear. There are some cells called hair cells because they have little hair bundles on the top that move back and forth. And so sometimes there's damage to those. There's wear and tear or other things that might damage them, some chemicals, some noise exposure, things like that. And that's the sensory part that we talk about. And then those connect with the hearing nerve that actually sends the signal to the brain. So that's how we encode sound and understand speech and sounds. And so if sensory neural hearing loss indicates that there's something going on there's something wrong with the cells and or the hearing nerve itself.
Got it. And just you're talking about the inside part of the ear. There's the outside part of the ear, but I think a lot of people don't remember that much of what's going on between sound hitting the body and then turning into a signal is actually something that you can't see. Is that kind of right, Chris?
That's correct. Yeah. So yeah, we have our ears and we think, okay, well, we'll pierce it. Sometimes kids have ear infections. There's, it might be itchy. You have wax in there. But once you get inside, actually in the head, there's so much going on there, and it's fascinating. So the inner ear that I talked about is actually a snail-shaped structure that's encased in bone, and it has fluid system in there. It has the cells. And you're exactly right, Jess. The sound is actually, like sound waves propagating through the air. And so they're kind of pushing air molecules. They push on the structures of the ear and the eardrum and the bones. And then that causes vibrations of those cells I talked about in the cochlea in the inner ear. And those vibrate from those sound waves. They kind of mimic what the sound waves are, and they create this signal that then we interpret as sound.
That's a really great description. Very helpful. Let me ask you another question. Is hearing loss genetic?
It can be, yes. So we're learning more and more about the genetic causes of hearing loss, because there's as you said, it's ripped from the headlines, right? You're hearing a lot about the genetic discoveries that we have. And so some genetic hearing loss actually would create the type of hearing loss that is present at birth. And so we identify that with newborn hearing screening. And so we can identify children who are born with hearing loss then. Some others can predispose people to developing hearing loss later in life, either through childhood or predispose people to have reactions with certain medications and things like that would end up causing hearing loss, or even age-related hearing loss. And so, yeah, and like you said, we're learning more and more every day. We actually did discover a new gene that causes hearing loss in a family in Wisconsin through the research in my lab and with my collaborators. It was really, we had a patient in the ENT clinic who had hearing loss and was getting treatment, and had some family members. And we talked to them like, hey, would you like to do some research together to see if we can figure out what this is? And it was really a wonderful partnership with this family, again, in Wisconsin, and got to know them really well. And they were so wonderful about sharing information and allowing us to do this research that we discovered this new gene that causes hearing loss. And we test for that now at MCW as well.
That's really amazing. I know you've taken care of thousands of patients and really helped a lot of families around hearing loss. I didn't know you'd also discovered a hearing loss gene. That's really, really amazing that you've done it and it happened here at MCW. Let me ask you, so if somebody, what should they do if they or a member of their family is experiencing hearing loss? What's the first step?
If someone notices they're having hearing loss, or another way to notice if you're having hearing loss is if a significant other or someone else is telling you that they think you have hearing loss, then what I would recommend, the first thing to do is find a hearing professional, go get a hearing test. Because again, like I said, a lot of the causes for the gradual onset of hearing loss might be just wear and tear of the cells in the ear, but there could also be something medical happening, and that you want to make sure you get that checked out. And a hearing professional, such as an audiologist, or would be able to do an evaluation, test the hearing, talk to you about it, give you some strategies and things that we could do. But then if it looks like there might be a medical cause for that, can then refer you to a physician to address that as well.
So what are the treatments available for people who are experiencing hearing loss?
Right now, so if there is a medical reason, for example, if there's something wrong with the bones in the ear, or some with the eardrum, something like that can be treated medically, then that is the route that we would go. We could do surgery. We can treat that medically. If it's really hearing loss that is bothersome, again, you have trouble hearing in some daily listening situations. If it's sort of a mild to moderate, then we would recommend hearing aids, for example, or some sort of amplification to help make sounds louder so that you can hear and understand them. Those hearing aids are custom fit, and so you can get those customized to what kind of hearing loss you have and the different pitches that you would need to be amplified. If it's really, even with well-fit hearing aids, if you still have trouble hearing in daily listening situations, even with well-fit hearing aids, then we do offer cochlear implants as an option. And so that is, as you said, I direct the Cochlear Implant Program. We do those routinely at MCW with Frederick and Children's Frederick Hospital in Children's Wisconsin. So that's actually an electrode array that is implanted directly into the inner ear and replaces those hair cells basically, and provides the stimulation to the hearing nerve through this electrode array.
Pretty amazing technologies that we've got available to treat a wide range of hearing loss. Let me ask you one more question before we turn to the audience. Are there disparities in terms of who's getting screened and treated for hearing loss?
Yeah, that's a great question. And we're actually right now in the ENT department, and my colleagues have a project that is actually looking at that right now. So our program is the otoclinomics program, and that's actually funded by the Healthier Wisconsin Endowment, the Advancing a Healthier Wisconsin Endowment. And we are currently looking at these disparities. And I'll break it into the disparities actually sort of are a little different depending on couple populations. So I'll mention for children, for example, the big key issue with children is to identify hearing loss as soon as possible. So we have universal newborn hearing screens. So as soon as a baby is born, all the hospitals do a quick hearing screen. And if it seems like there might be some hearing loss, again, it's a screen, we don't really know, then we would refer for follow-up testing. And then the family will need to go to a facility when the baby's a little bit older. You go to the facility and you have a full hearing assessment. And that's one place where their disparities can live. And so sometimes there's a lot of travel. So if you live in a rural area, or there are other issues about transportation or getting to the site that has the special equipment for us to do that, that's where we can have a disparity. And so we're looking at that now to see what those are, and then how we can address those so that we can identify these children with hearing loss and address that early. The adults, what we tend to see is there are disparities within racial lines and ethnic lines, and then also with socioeconomic as far as hearing aid use. And so oftentimes, and we find this a lot with hearing aid use anyway, is that they're very expensive. And so right now there are some disparities there. So if people can't afford hearing aids and they're not covered by insurance, then or by Medicare, then they might not be able to access amplification. And so the FDA, I'm glad you asked about this too. So we're really working to address these disparities. And the FDA right now is working on guidelines to allow for over-the-counter hearing aids and other amplification options for people that would be far less expensive and a little more direct to people, so that to make amplification more accessible to more people.
Well, that's really great. So let's go ahead and turn to some of the questions we've got from the audience. We've got a lot of great ones, and we'll get to as many as we've got time for. The first one is, does ear ringing indicate hearing loss?
So ear ringing is the description of what it sounds like. Yes, we do call that tinnitus or tinnitus, you might hear. And it can. And so a lot of times what we think is what causes some of the ringing in the ears is that there is some damage to those cells perhaps. And then you might not notice the hearing loss so much, but you might notice the ringing first. And so, yeah, that's definitely something if you want to go have an evaluation on that as well. We do have a tinnitus program at Frederick Hospital. And so we have audiologists do a whole lot of testing. They'll test your hearing, they do pitch matching, and they counsel you about it too, about strategies to deal with the tinnitus. If you notice too that if you have ringing, if it's really in one ear and not another, if the ears are different, same with hearing loss. If you notice a difference between your ears, I definitely would recommend that you go get that checked out, just to make sure that there's not something going on to cause something in one ear that's a medical issue. But yeah, so a lot of times we do think that the ringing in the ears is just indicative of some level of damage to the inner ear.
Great. Next question is there a connection between hearing loss and Alzheimer's?
That's a fantastic question. I think what we are looking at, that's under investigation right now. There are big multi-center trials all over the US. And I don't think we've answered that particular question right now. And when we talk about Alzheimer's, when we talk about dementia and cognitive disabilities or cognitive issues, then and Alzheimer's, they're kind of, a lot of them are very different disease processes as well. So some might be vascular, some might be from lack of stimulation from sound, for example. I'm not aware of a connection specifically with Alzheimer's. I think there are major drivers of Alzheimer's that are not necessarily related, but I think what we're finding is seems to be a connection between hearing loss and having cognitive issues or some sort of dementia. And it's hard to say exactly what's causing that right now. Maybe it's lack of stimulation or lack of awareness of surroundings can exacerbate. So it's a disconnect from your world. And we know that when you can keep your cognitive abilities up by engaging with the world, by, doing brain teasers, things like that. And so I think this lack of stimulation in this way can help exacerbate that. But that's a great question. We're looking at that now. Mm-hmm.
Great. The next question is there a connection between cancer treatments and hearing loss?
There can be, depending on the chemotherapy medication that's being used. So cisplatin is one of those that it's used to treat a range of cancers, for example, head and neck cancer, and then some other ones. And so there are a couple things, so that it is possible that cisplatin use can actually cause some hearing loss. Now, we always weigh those options. So we work with the hemonc docs, and they're really fantastic. And actually, what's great about Frater and Hospital and Children's Wisconsin is we're very aligned in wanting to monitor hearing while people are having treatment, from chemotherapy treatment or sometimes radiation treatment. If the ear is in the line of radiation, it can cause some hearing loss there too. But it's part of our clinical protocol, and we all feel very strongly that we want to make sure we're monitoring the hearing loss. We measure hearing before treatment and then at intervals during it. And if it seems that if we're able to change the treatment because it looks like there's some hearing loss, then we want to make sure to do that. It's always that weighing, though, of the treatment that can save your life versus what kind of things might be happening for hearing. What we do, this does bring up a really important point. For people who are getting chemotherapy or susceptible in any way for having hearing loss, is we recommend hearing protection. So we want you to wear earplugs. So while you're getting treatment, it can be exacerbated by noise exposure. For example, even mowing the lawn or vacuuming the house or some of those daily tasks. We want to make sure that people are really working to protect their hearing, so we don't have that combination of medication and noise exposure causing even more hearing loss.
Thanks. The next question I've got is, have you heard of sudden hearing loss, where there's not a gradual decline, but it's just all of a sudden gone?
Yep. Yes. So if you experience sudden hearing loss, it can be different forms. I've actually seen some people come in like, oh my gosh, I have hearing loss in one ear, I can't hear anything. And they come in and it turns out it's wax. And so it might get cleared out and then you're good to go. I mean, that has happened. However, I wouldn't assume that. So yeah, if you notice hearing loss, that like very sudden hearing loss in one ear is more typical. It could be both, but usually it's one. If you notice that, then get seen right away, come in, see an ENT, and see a specialist right away. What they tend to do is then they might treat with oral steroids or an injection of steroids or something. There are medical ways to address it early on to try to then see if we can get that hearing to recover. But yes, we call it sudden sensory neural hearing loss. Come in, we'll get your hearing tested, and then we'll intervene as soon as possible.
That's great. I still remember my great grandmother could only hear one family member on the phone with a really deep, booming voice until she got her earwax removed. So certainly, I think that's good advice. Related question to some things we talked about earlier. Does anesthesia cause or contribute to tinnitus?
Anesthesia. I actually don't know the answer to that offhand. And if it would be the actual anesthesia itself, if it would be positioning of the head or something that's happening while the person is under anesthesia. So I don't actually have a specific answer to that off the top of my head. I'm not very familiar with that happening frequently, but Jess, I don't know. Do you know the answer to you?
Well, it turns out I'm an anesthesiologist. There are medications, used during surgery, antibiotics, other kinds of things that can cause some changes to hearing and potential tinnitus, but it's not a common thing. The next question we've got is, does using a hearing aid as soon as hearing loss is noticed delay the progression of further hearing loss?
That's a wonderful question. And I would say no, it doesn't necessarily delay the progression of hearing loss, but what it would do is allow you to maintain your brain function for those higher, for example, it's usually that we start losing those higher pitched sounds first. So that's where people notice like, oh, I can hear people, but I can't understand them, because we can still hear the vowel sounds, but we're not necessarily catching up on all those, the S and the TH and some of those other high pitched consonant, soft consonant sounds. So if you start wearing amplification early on, then you continue hearing those sounds and able to process them and things. If you let the hearing go for a long time and you haven't heard those high-pitched sounds for a really long time, and then you put hearing aids on, first of all, it can sound terrible. So the high-pitched sounds sound very annoying if you haven't heard them for a long time. So what it will do is if your hearing loss does progress, you can always like have your hearing aids sort of bumped up so you can get those higher pitch sounds as you need them. So it won't delay the progression, but it'll keep you engaged with those sounds and able to use them and communicating really well, and not falling into some of those other issues about not hearing them for a while and not being able to communicate.
Makes a lot of sense. I've got one more tinnitus question and then a couple about cochlear implants. So somebody wants to know, what is the thing that you can do to address the case of tinnitus? I imagine it has to do with what's causing it, but maybe some of the common options that you have for folks that come into the clinic.
Yeah, so in general, sometimes what we'll do is talk about, stress. It can be stress related as well. I mean, we do think that there's probably some damage in the ear, but at the same time, sometimes stress can exacerbate it, even clenching your teeth. There are other things that can also cause it. So we talk about stress relief and or managing it, not focusing on the tinnitus, kind of learning to live with it, keeping it in the background. Other options, though, so besides those are there are some apps out there that we recommend, and like sound therapy, and so there's options for that. So you can listen to sort of like modulated music, and sometimes that'll help kind of retrain the brain to pay attention to those sounds. And then you can do notch noise and things. So for example, you listen to some sounds that are around where your tinnitus is to bring awareness of your brain to those other sounds. Sometimes too, we might recommend tinnitus maskers. And that's just basically like maybe a hearing aid type thing, or a device worn in the ear that has some very low level, maybe staticky sounds or something. It can just kind of drown it out a little bit, but it doesn't interfere with your hearing. And also hearing aid use too, if you have hearing loss as well, sometimes amplifying the actual sounds then can help minimize the tinnitus as well. So there's also some new research and devices going on with transcranial magnetic stimulation. So we're looking at those. That's kind of catching on for a lot of different health issues. And so that's something too that's under investigation as possibly helping with tinnitus.
Well, great. Sounds like there are a lot of good options depending on what the problem is, and it starts with getting somebody into getting screened. Next couple questions are about cochlear implants and other technologies. So somebody wants to know, is there specific training or learning that's necessary for somebody who receives a cochlear implant?
That's a wonderful question. And so if we talk about adults who have already who have had gradual onset of hearing loss, a lot of times the amount of training necessary to be able to hear and understand, really you can hear with a cochlear implant really well once you have it. It's just understanding speech, because it's a totally different way of hearing. So right now we go from acoustic hearing, like is how we're doing it now, and this is electric hearing. So it just sounds a little bit different, and you do have to get used to it. A lot of times it will depend though on how long someone has had hearing loss and how severe that hearing loss has been. So if someone has had very little, like pretty profound hearing loss for a long time, it might take them longer to sort of get used to it and understand speech again. However, if someone's been using hearing aids for a long time and they're used to listening to a sound that's not optimal, then it might not take quite as long for them to get caught up with that. But we do recommend with our patients who receive cochlear implants, we do offer some oral rehabilitation, either through our clinic in the ENT, or with Healthier Wisconsin is our community partner as well. And they have wonderful therapists too to help do oral rehab and practice things. And the cochlear implant companies also have software, and there's a lot of different ways on the internet to do some hearing training and things like that, and kind of test your ability to hear some sounds and get used to it. So a lot of different ways for people to be able to get used to hearing with their implants.
Perfect. The next question is, what's the difference between advanced bionics and cochlear implants? And I'm hoping you know what that means, because I don't.
So cochlear implant is sort of that's the category of these devices that we implant in the ear. Again, electrode gets implanted in. You have an external processor that either is on the ear or it can be magnetically attached to the side of the head above the internal device. And advanced bionics is a certain brand of cochlear implant. And advanced bionics is actually so we have advanced bionics, Med-El, and cochlear, which are three that are available cochlear implants in the US. And at our center at the Medical College of Wisconsin and Children's Wisconsin and Frederick Hospital, we implant all three devices. We offer all three. Advanced Bionics is the US company that develops the hearing aid. They're out of the cochlear implant, they're out of California. Med-El is out of Austria, Innsbruck, Austria, and cochlear is out of Australia. So it's a very international initiative. But yeah, so we offer all three devices, but Advanced Bionics is one type, one brand.
Got it. Thanks for helping me understand what that was about. The next question I've got is, are there certain hearing aids that are best for moderate hearing loss?
Yeah, I think so hearing aids do come in different flavors, if you will. So it depends. If you have a moderate hearing loss and there's if it's pretty flat or a little high frequency moderate hearing loss, then yes, there's a range of types of hearing aids that could work. So there's some that hang behind the ear that would be fine with an open dome, open mold. There are others that if you have really pretty much moderate hearing loss, then you can have the ones that fit in the ear canal. And so they don't have to hang behind, but they can go in the ear canal and they can kind of go a little ways in so you don't even really see them. And so that it kind of opens up a little bit of a range of the types of hearing aids that are possible. Really the circuitry and stuff is we can kind of make it whatever it needs to be, but there are some when there's pretty severe to profound hearing loss that it really does require a hearing aid that sits behind the ear, and they're very small these days, but sits behind the ear, has more power. It has more power to it, and of course and has to have batteries and things that it uses the batteries a little more quickly and stuff too. So yeah, for moderate, you just have a few more like options as to how the wearability is.
Got it. And then does sound therapy help those with lifelong hearing loss or just recent loss?
The sound therapy for tinnitus that I was talking about, honestly, I think it's worth a try, even if you've had long-term tinnitus or hearing loss or things like that. So I think I was referring to the sound therapy for tinnitus intervention. So obviously you would need to be able to hear the sound for the sound therapy to be able to work as well. So, but yeah, and I think it can work for people who have had long-term tinnitus. It can work for people who have had it more recently. But again, regardless of that, if you have especially new onset tinnitus and it's noticeable, then I would definitely be seen and see what would be appropriate treatment for that.
Got it. Next question is, if somebody's having difficulty hearing what is said, like they can hear sound, but they're maybe mixing up words, similar sounding words, is that considered hearing loss?
Yeah, I would say yes. Now, unless there's some other underlying cognitive cause of that, about not understanding, but for what we're talking about today, certainly if you've noticed a gradual, like I can hear people, but I can't understand, and then yes, and especially like, wow, I'm having a lot of trouble in background noise, I think then that does indicate that there's probably some level of hearing loss there, and that you might want to get that checked. And even if there's not something that we necessarily do for intervention right now, it's always good if you notice that to get seen, and then you can follow up later if you notice it gets worse or you notice even more significant changes. And also we do a lot of counseling too. If you do notice those sorts of things, it's not just hearing aid or nothing or something. It's also here strategies. So you sit in a room, you might sit in the front row. You want to sit where there's good lighting. Make sure that your friends, your significant others know to face you when they're talking to you, and not talk with their mouth full, or, do this kind of thing, or yell from the other room. You might have to come into the room to talk to somebody. So there are other strategies that we also like to make people aware of too.
Great. I've got one more question that I think we'll probably have to end because we're almost out of time. Have you ever seen somebody in their 90s get an implant? What's the surgery like? How long does it take? What's recovery? That kind of stuff.
Yeah, we have. And can't remember the exact age of our oldest recipient of a cochlear implant, but he was well into his 90s. And honestly, if you're healthy, and if you're healthy enough for the surgery, then yeah, we would recommend it. And if you want to do that, absolutely. And so it's a surgery. It's a very small incision behind the ear, a little bit of drilling in the bone just to open that area up so that we can get the implant in there. And then a healing time of about a month, and then we can hook you up, and then you can start hearing. So yeah, we do it in far older. So again, if you're healthy enough to get the surgery, then you're audiologically a candidate, then absolutely.
Fantastic. Well, and with that, I want to thank you, Chris, for joining us today. This was just a fantastic conversation. For our audience, if we didn't get to your question, feel free to drop an email to conversations@mcw.edu. We'll try to take care of them. I hope you'll all join us next month for a virtual conversation and a coffee break and more about science. Thanks so much.
Thank you.